Multitasking. Hello again, Peter.
Hi, how are you? Long
Good.
time no see.
I know. Peter and I were hanging out last night at the new member, District 7070. They had the new member meeting, and Peter was there, and so was I.
Did you enjoy it? Did you get something from it?
Yeah, I think it was very informative. Yeah, it's kind of pretty broad. I mean, when you're up in the RI level, it's pretty big stuff. So just to know that it's there and how it all works, and yeah, it was good.
Well, that's only part one of it. I mean, each one they give you more detail and so on.
Yeah.
Yeah,
there's a lot more to come.
You'll probably end up knowing more about Rotary than half the members of the club.
Well, I'm still pretty keen.
Good.
I had to laugh. Ron Dick was there as well, of course, and he's like, "So, have you dried out yet?" I'm like, "Barely."
Yeah.
It was wet.
Mm-hmm.
All right, so it's just after 7, so I don't want. I'm not Joe. I'm not who you're waving at, Joe. But hi.
All right, no, it's just somebody. Catherine just came on video, and I was just waving him. I could wave at you too.
So I think we'll get started. I'll try and admit people as they're coming in. I'm going to try and keep on that. Good evening, everyone, and welcome to the August 26th meeting of the Bowmanville Rotary Club, our monthly evening meeting. So I know we're a bit short on people, but it is August. It's holidays. You know, I wish I was Rachel right now. I'm not going to lie. So welcome. We do have some guests here. I know some of you will be more formally introduced later. I can see that we have, hold on, let me see if I can, we've got Kate and Veronica, Monique, Barbara, Emmanuel. I think those are our guests. I'm assuming, I think most of them are affiliated with the Ugandan club that's going to be speaking to us this evening. So welcome to all of you. I realize I don't have a glass of anything, but this weekend or tonight, our toast tonight is to us. I want to toast the Bowmanville Rotary Club because you guys did a phenomenal job of stepping up and making this past weekend a great weekend. So cheers to the Bowmanville Rotary Club and to our citation.
Cheers.
Cheers.
Well done, everyone.
Wayne, I believe you have our invocation this evening.
Yes, I do, President Amy, and this is very short, but I thought it was appropriate for Rotary. We make a living by what we get, but we make a life by what we give. That's it.
Very good. Short, sweet, to the point. Like it, Wayne. Our land acknowledgement, we want to acknowledge that here in Bowmanville, we're on the territory covered by the Williams Treaty, and that this land is the traditional territory of the Mississaugas of Scugog Island First Nation. We offer our gratitude to our Indigenous peoples for their care of the land and their teaching of our earth. Pauline, birthdays, anniversaries?
Yes, President Amy. I was remiss last week. I wasn't thinking that we wouldn't be meeting on Tuesday morning, and I actually missed a couple of birthdays, but we can mention them now. Andrew, you're on the call, and Andrew had a birthday on the 24th, so happy birthday, Andrew. And today, Mandy Hoy has a birthday. Then this coming week, Sally, Dave Sullivan's having a birthday, and Keith Hill. So we've got 4 birthdays to celebrate. And wedding anniversary yesterday, Tim and Debbie Functions celebrated 42 years of married bliss. So congratulations to Tim and Debbie. And that's it for celebrations this week.
Perfect. And welcome to Connie, who's joined us on our call. And that being said, I'm going to pass this over to Joe, who is going to introduce our speakers and have a little interview with them. So take it over, Joe.
Thank you very much, President Amy. When we were lucky enough to welcome Andrew Saway into our club a few weeks ago, one of the things that really interested me most about his story was his connection to another Rotary club in Uganda, which he talked a little bit about. And I wanted to learn more about that club and learn more about its fellow Rotarians. And so he connected me with its president, and her name is Catherine Barasa Asekenye. Have I pronounced that right? I think, Catherine?
Yes, precisely. Yes, thank you.
Her friends call her Kate. Her educational background is in sociology, gender and women's studies, and international public health. And as I've been finding out, she's also a bird lover, as am I. And as it turns out, she is the founding, that's the first president of the Rotary Club of Sonde. Sonde is a community just outside of Uganda's largest city, Kampala, and much like Bowmanville and Toronto. And the connection goes even further because she has two children, David and Barbara, who are both studying in Toronto right now. And I think they may be at the meeting here with us tonight. She writes on her club's website, when I moved to Sonde in 2019, I thought it was an opportunity to support the establishment of a new Rotary club. My inspiration was Paul Harris's compelling reason to form Rotary as a young lawyer in a new city of Chicago. So she started that new Rotary Club in March, just this past March, with the unbelievable founding total of 122 members in a brand new club. I've been to a couple of their club meetings on Zoom, where they generally have, are you ready for this? 5 pages of participants. That's like 150 people on the line, seemingly from different parts of Africa. And you have to see the energy in the club is incredible. We have been chatting about quite a bit, she and I. She's been very supportive of what's been happening in my own family, which so thank you very much, Catherine. And then in the interest of brother and sisterhood in Rotary, I invited her to speak with our club to tell us about her club's work and how she was able to start a brand new Rotary Club with 122 members, which I'm told is now up to 135. It still may be growing, I don't know. She's joining us now from Sonde, where it is just past 2 a.m. So thank you for joining us, Kate, and I'm just going to turn it over to you for a wonderful presentation.
Well, thank you very much, Joe. May I have hosting rights so I can share my screen? And President Amy Bani, thank you very much for having us today. As I get the opportunity to share the slides, I'd first of all like to say I'm really, really thrilled to be here. Thank you so much, and thank you for having my two children, David and Barbara, join us tonight. I'd also like to thank my club members, Vice President Connie Magomu Masaba, for making it to this meeting. I can see Rotarian Monique, Rotarian Robert, Rotarian Edith, and Rotarian Emmanuel online. Thank you very much for joining me in this very important visit, a very first visit to an international club. Am I able to share my screen?
I
Yes.
think you should be able to, yes.
Yes, thank you very much, President. Okay. So, as I said, we're really happy to be here, and we'll begin first by congratulating you, the Rotary Club of Bowmanville, for the Rotary International Citation. That is really exciting. And also to share that the Rotary International President is visiting Uganda on September 13th to 14th. And as the biggest club in the district, we are looking forward to being part of this visit. We are the Rotary Club of Sonde, based in Uganda, as Joe has introduced. We're a very large club, we're an award-winning club. We are a community club, and this is the founding members. It was 12 members who started this club last year, 2020, on June the 12th. We had this first meeting to discuss how we would grow this club. And from 12 members, we have grown to a very big club chartered at 122 and now 139 members and still growing. That picture was on our charter night. We are a very happy club. We have been having lots of activities together, hosting different Rotarians in our club, hosting our district leaders and friends around the community. And above all, we would like to share a little bit about the club. Chartered on March 29th, we're 5 months old now. We had 58 men and a few women and 64 men at charter. We contributed to 25% of the district 9213 membership last Rotary year. And currently we're 139, 67 females and 72 men. We come from different locations and some of our members are located in various countries, both in Africa and beyond. We have one in Australia. We also have one in Canada. We also have another in Kuwait, in Dubai, in West Africa, and many other countries. We have another member in Tanzania and a Rotarian Perry in the UK. We happen to be the most diverse club. And indeed, at this year, we received the award of the most diverse club in the district, and also the club that has the highest gender balance in the district. We, as a club, have about 58 different classifications, including civil aviation, medical services, education services, and many more. We have, as a young club of 5 months, we have been able to do a lot. The country is facing a huge burden of cancer. And so we have been part of the cancer run activities aimed at raising money to build a cancer hospital that Rotary is leading on in Uganda. And that has advanced so much. And very soon on Sunday this week, we will be having yet another cancer run. It's an annual event that happens in District 9213. We have already launched our pre-cancer run activities, and this was one of the pictures where after the run, we were able to celebrate one of our members' birthdays, and we had family with us. We are a family club, we're a neighborhood club. We know each other, and before COVID, we also had our children participating every day we met on, or every Sunday that we met. We also have a play area around where we meet. We do a lot of exercise, a lot of fitness activities and nutrition activities. And this was at the launch, the very first activity that we had around our fitness. We care about our members' health and the health of the community that we serve. We have also participated in the polio activities. We supported the vaccination of 300 children last year, and we look forward to doing more of that this year. We also provided health education. We also had awareness on adolescent health, and we have a very cordial relationship with the nearby health facility in the community. That is us. We have also managed to do a few charity activities within the community. It happens to be a very a poor neighborhood where we have homes that support people with disabilities, homeless people, and so on. So we do care, we do share, and we actually provide whatever we can in terms of food items and utilities to the home of the needy and many other institutions that surround the community. We are a club that is interested in climate change in the environment. So we have done donations of trees. We have encouraged the community to protect the environment, but above all, to continue greening the environment and advancing a safe and green environment. Our approach to Mission Green is to work with schools, and we do have a few schools around where the club is located. And so we have done activities in schools to interest the children in trees, to train the children on planting trees, on protecting trees, on the value of trees, and so on. We also encourage children to speak to their parents, and we provide seedlings to our kids to take to their homes and ensure that they are planting and loving and owning trees. So this is us again in one of the activities, the same activity where we demonstrated how trees are planted. We have a classification of people in environment management services who lead this program. And I thank Rotarian Betty so much for leading us on this very, very important activity. We also care about the cleanliness of the environment. We have a lot of pollution by plastics in the community. And so once a month, we do get out as a Rotary Club to work with the community to clean up the environment and advocate for a clean, keep Sonde clean activity. We're committed to doing this every once a month until when it is institutionalized in communities. We will provide disposal areas. We will introduce recycling activities, as we advance in this Keep a Community Clean campaign. We were hit as a club, we were hit by COVID-19. A number of our members acquired, unfortunately, got infected with COVID. We then advocated for COVID-19 vaccination. We, as the leaders, started, taking the vaccination early. Unfortunately, the country is short of vaccines, so members are willing to get the vaccination, communities are willing to get the vaccination, but are unable to access the vaccination in time. We hope that very soon the country will be able to have more vaccination. We have also worked on supporting the elderly during the COVID period. A lot of facilities that look after the elderly, the children, the disabled were hit by lack of food, lack of utilities. And so we're able to put some little resources together, get maize grain, get supplies like masks and so on, and sanitizers, different assortments of soap, and all the utilities that are required in this facility. Here is a facility that is run by Catholic nuns. They look after more than 200 people, elderly people, homeless people. And so we have a relationship and a partnership, and whenever we can, we do visit and provide support. We are a club that has very huge dreams. First of all, our first priority right now is to look at the impacts of COVID. The communities are struggling, and indeed, a lot of communities can no longer afford their livelihood. A lot of communities have been locked down for such a long time, and the impacts have been huge. Lots of young girls have become pregnant because schools are closed. The girls are in the community, and they've been exposed to all kinds of rights violations. We have communities that can no longer afford food and other utilities, and the impacts are very, very glaring. So we hope to continue supporting in a small way the communities around the club in this way. We've also identified the need and the low-hanging fruit that we as a club would like to intervene. Access to sanitary towels, particularly by teenage girls, is a huge challenge. It's one of the factors responsible for the dropout of girls from school. Girls are exploited sexually in exchange for money to buy sanitary towels, which is really sad. Moms do not go to the facilities to have their babies safely because they're supposed to report to hospitals with delivery kits, and a number of them cannot afford a delivery kit that costs about $2 or $3. So we see that as some of the low-hanging interventions that the club can support. We are also interested in education and literacy programs because we have about 15 members from the education classification. And so there is a proposal to focus on early childhood development, because children are rarely brought in the mainstream of education, especially age 0 to 6. Our age for entry into primary 1 is 6 years old. That's the official age. And below that, there are no official institutions that support children. That has been relegated to the private sector. So many times children miss the opportunity for cognitive development at that stage. We have challenges of water, hygiene, and sanitation, and quite a number of poor households, about 200, who cannot access piped water in the Sonde community. So some of the members in the water and sanitation classification are thinking how they can support to improve at least one water source in the next 2 years to enable people access clean drinking water. Our latest dream is to look into maternal and child health, because every day between 14 to 20 women die giving birth, because the facilities are very, very, very poor. The health workers are unable to provide adequate care, birthing care. A lot of teenage mothers, as I've talked about, do not access adolescent-friendly services. And so most mothers have their babies on their own at home. This is a picture of one of the water sources very close to where the club meets, and the community is only able to provide a short pipe to kind of tap the little water that they can access. And so you can see children with jerry cans trying to wait for them to fill up. It's dangerous, it's slippery, and this is a source that supplies 200 households and above. We have also, as a club, supported some disease prevention activities. This is a community that was introduced to us by one of our members, Rotarian Jennifer Achiko, where her community was struggling with an outbreak of scabies, mainly among children. And so we were able to put together some money, and were able to buy some medication and get our health care team to visit the community and provide some treatment. And indeed, we hope to continue with this activity, public health intervention in this area to help with this problem. As I said, one of our ambitions and a very, very latest and passionate project, a signature project, so to speak, is the maternal and child care project. In one of the communities very close to us, there's only one delivery bed in Bukerere Health Center, and this is the bed that exists. So all the mothers deliver on this bed, in this environment, in this very, very unhygienic environment. Sometimes when there are 2 or 3 mothers in labor at the same time, it's very challenging for the health workers. And indeed, as soon as the mother delivers, she's expected to go home because there's no facility to keep her for postnatal care. And because of that, lots of infections and so on have been experienced. And neonatal deaths of children are very, very high in the community. President, I request that you allow me to share this short, very, very short video, just to show what we have been able to put together in terms of the signature project. We visited the community and the health facility. Thank you.
The video hasn't started yet, Kate. I'm not sure.
Oh, it hasn't?
No.
Oh, shame.
I would love to help you, but I have no idea what to do.
Well, the cursor seems to be on the link, but you're not clicking, are you?
Okay, I'll just do that again. I'll go through it again. Is that better?
We don't see anything.
Connie has the right idea. Can you copy the link and put it in the comment, the chat box? And then Amy can take that and click on it.
You say that like Amy knows what she's doing.
Okay. Put it in the chat box.
There's still a problem?
No, we don't see it.
Oh,
don't
yeah,
see it.
okay.
Are you sharing?
So
Are you hitting
sharing.
share screen? Maybe I can try doing it from here. You send it to me.
Okay, apologies for that. Let's see how it, let's do it one more time. I hope this time we'll be able to have a, let's see. Okay, there we go. Okay.
If you are seeing it, Kate, and we're not, maybe you just have to share the screen again.
Ah, okay. Is it showing now?
Oh,
No?
You have to click on share screen again.
Okay, okay, let's do that. Let me see.
I've got it up here. I can
Okay.
play it. I can play it from
Okay.
here.
Thank you. Thank you.
Okay, let me just see if I can
Thank
do
you.
that.
Thank you.
Share
just,
screen. There we go. There's that. Can people see that?
yep.
Okay. I'm gonna play sound. I'm gonna play the sound. How does one do that? Just a second. Oh boy, oh boy, oh boy, oh boy. Oh my God, I just put that in. Hang on. The sound is always a problem. I had it. Where is it? Hang on. No, I've lost it now. Here we are. This. Share screen. Where's share screen here? No, I've lost it. Hang on. Share screen. Share sound. Okay, share. Let's try this now. Can people see?
Yep, works.
Bukelere Health Center 2 is located in Goma Division, Mukono District. It's a private, non-for-profit health facility. It was founded by the Catholic Church under Lugazi Diocese and serves the 8 villages of Kasai, Namwezi, Chiwangu, Kagala, Namasinga, Cheserekera, Bukerere, Chipapali, also known as Mawangala. According to the district records, the facility has a catchment area of 14,000 people.
We can offer like inpatient, maternity, postnatal, lab services, and also immunizations too.
The facility serves between 45 to 60 clients daily in the outpatient department. In a month, it handles between 25 to 30 health facility admissions due to limited space. It has 2 single-bed admission rooms, one for females and another for males. It also handles an estimated deliveries of between 6 to 12 mothers in its single-bed maternity ward and free antenatal services to over 60 clients monthly. Immunization here is free, with an outreach of between 500 to 1,000 children monthly. The existing small building serves as a consultation room, waiting room, which doubles as a triage area, treatment room, laboratory, store or pharmacy, maternity, and 2 ward rooms for admissions. Apart from space, the health center also grapples with a myriad of challenges, including staffing and access and availability of equipment, as well as protective medical supplies.
Privacy is still a problem because you might be having a mother, then someone passes by. So privacy, because of the limited space. Still, even the patients, we have only 2 rooms in patients, male and female.
It's against this background that the church, with the community and the partners, have managed to raise funds to construct a bigger and equipped maternity ward. But the funds have only managed to take them this far. This makes the upgrade of Bukere Health Center to maternity ward a signature project for the Rotary Club of Sonde for maternal and child health objective.
We are grateful for whatever good we are going to give for the common good of our people around our locality. So thank you very much.
For more details about the project, please contact the President, Rotary Club of Sonde, Rotarian Catherine Barasa.
Okay, thank you very much. Thank you, Joe, for helping out on that. Unfortunately, I can't get back to my video now because of the screen share. If you would like to unshare. Thank you. Hello.
Yeah. Joe, you're muted. Okay.
Okay, so thank you very much. Thank you, Joe, for helping out there, and apologies for that hitch. So that's the end of our presentation tonight. We thank you very much for having us, and we look forward to more engagement with your Rotary Club. We are really, really honored to have had this opportunity to be with you. Thank you very much. And I'm happy to take any questions, any comments, so we can have more discussions on our club. Thank you. Thank you, President Amy. Thank you.
Thank you, President Catherine. That was phenomenal. It was lovely. You did a great, fantastic job. Are there any of our Rotarians that have any questions for our Ugandan friends? Chris.
I do have a question. Quite a presentation. It's really amazing how you guys manage with the resources that you have, looking after all those people, essentially with very inadequate resources, and hopefully you'll get the help that you need. The question is regarding your membership. I see you have members from 37 locations in 7 countries. How does that work? I don't get that.
Yeah. Thank you very much. That's a very interesting question. We actually set out to have a very big club. That was our intentional goal. And so we opened up opportunity for members to join beyond the community of Sonde. So what we did, each of us reached out to our OBs, our old girls, our friends, our relatives in the different parts of Kampala. And indeed, when COVID set in, the online opportunity became evident. And so members are able to join meetings, join conversations, join activities online. So we've taken full advantage of that to be able to have membership growing beyond the community of Sonde. And so members abroad, members in different districts and so on join online. And indeed, we hope that the space will clear soon, so we are able to also have some face-to-face meetings. Thank you very much.
And do these members pay a membership fee, or is that does not apply?
Okay, so every member registers with the club and pays a membership fee in order for them to be inducted into the club. So every member does pay the membership dues. Thank you.
Thank you.
John?
Yeah, I just wanted to point out to Chris that the latest club in District 7070 is called Goals. And there are members of that club in 9 different countries. So we have a club in our district, Chris, that is from many countries. It's becoming more commonplace, which is helped by Zoom.
Yeah, of course.
Zoom has a lot of benefits as well as people getting fed up with it, but it works.
Yeah, okay.
Joe?
Yeah, you do have members from all over the place, but at the same time, you're really, really visible in your community where the need is really great. And my hat's off to you, and I applaud your work in your community. What role do you think that you play in the life of Sonde? Because the need is pretty great, and you're out there doing a lot of things. How do you see yourself in terms of being part of Sonde? How do you see your club?
Thank you very much, Joe. We see ourselves as part and parcel of the club, of the community. We see ourselves as a very well integrated service club to the community, supporting with what we can. We believe that little is much, and so even offering our services to provide basic education on health, on hygiene, on boiling water for safety and so on is a huge contribution to our community. We look forward to being able to grow as a club and have more visible, more impactful projects, particularly looking at the great need of child survival and survival of mothers, because women do walk a long distance to be able to get skilled care when they're birthing, when they're having babies. And a lot, as I said, do deliver these babies on their own at home. So we're looking for partners, we're looking for friends who have the common interest to kind of begin small and grow that intervention to support the community. We're also aware that most of our community members have not had the COVID vaccination. So we are linking with the Ministry of Health to bring that service as soon as they can closer to the community, because we've had some deaths also within the community related to COVID and many more. Thank you, Joe.
Can you talk a little bit more about the maternity plans for the expansion and the need for that?
Well, thank you again. The Catholic Church in a very remote part of our community recognized the need to build a maternity ward. And so they started a facility in 2017. Unfortunately, it was abandoned because they do not have adequate resources to complete it. And so one of our members who lives close to this community informed the club that there is an opportunity here to partner with a small community that is trying to do something. And so we visited the facility, spoke to the health workers who are in place and community leaders who indeed expressed this as their #1 priority. So we plan to see what we can do to put some resources together to finish the infrastructure that is already roofed. They have walls, they have everything done. So it's completing the structure and hopefully offer additional delivery beds, maybe 2 or 3. Help with the recovery rooms, set up with 2 or 3 or 4 beds and grow that, with time. I know we might not be able to provide incubators and all the, delivery kits that are needed, but incrementally, as we bring on more Rotary clubs, more people who are interested in this area, we might be able to transform a little bit and save a few more lives. So we also are going to work with the communities to try and address the issues of teenage pregnancies, to encourage and support these girls access whatever near facilities that they can. Otherwise, the situation in terms of teenage pregnancies since COVID is really appalling. Thank you, Joe.
John, did you have another comment or question?
Yes. Kate, have you considered trying to obtain a global grant?
Yes, we have actually considered obtaining a global grant, but being a young club of 5 months, we would need to partner with an already existing and experienced club to be able to put in a global grant proposal. So yes, John, we are really very interested and thinking about that. And we hope that that is one of the areas that we might be able to discuss with another already experienced club. Thank you.
Okay, good.
Oh, Fred, yep. I think you might be our last question, but Fred, you're muted though. You're muted, Fred.
How's that? Is that okay now?
You're good.
Terrific. Maybe you could consider us carrying on this conversation at a later time, and we might be an established club that would like to try out a partnership with you with respect to this. It'd be a good experience for our club, which hasn't done one for a while. I'm just putting that out there for maybe the future president coming up, or maybe wrapping up. Like, I think a discussion could start, because it might be very beneficial for both clubs on both continents, Africa and Canada or North America. It's not that difficult. It just takes a little bit of time and cooperation. And I think you folks are doing a terrific job, and we could learn a lot from working with you, I'm sure. Thank you. That was just there was no question. It was just a statement.
Your work is really inspirational, Kate.
Yeah.
Wow, thank you so much. This is very, very encouraging and really touching. And indeed, I will be very, very excited to have your club as a partner, as a future, with looking forward to future opportunities to work together. And indeed, we are open to that. Very, very happy to hear those suggestions from you, Fred and Joe and everybody online. And indeed, let's carry this discussion forward. We've done the needs assessment. We'll continue to engage the community, support in the little way that we can. The few mothers that trickle in will be able to provide some delivery kits. It's a small pack with cotton wool and all the utilities, plastic papers and so on, to help with the delivery process as we wait to see more impactful and sustainable opportunities through a grant and any other means that we might be able to get. Thank you so much. Really appreciate.
Okay, Ellie, quick though, please.
Yeah, very quick. One of the things that concerns me, I'm the director of the International Committee, going after a global grant. Rotary in the past, and has been my understanding in the future, will not build a building. They will get medical equipment and that line, but they will not construct an actual building. Do you have somebody that is willing to build the building? So if we partner and go after a global grant and pull in other Rotary clubs from around North America and Africa area, do you have somebody that would build the building?
Well, yes, thank you so much. And we indeed have recently learned that the global grants come in to support additional activities. So yes, the answer is yes. We are approaching some of the clubs within the district, and our own members are willing to put in resources incrementally to help finish the structure, because the walls are up, the window frames are up, the roof is up. So what we need to do is to plaster the building and paint it and give it a decent flow, and it's done. So the civil works that are left over are really things that we will be able to support locally, and also find other individuals that might be willing to provide in-kind building materials. We're approaching small companies that do materials production around the city, and you know, interesting them to provide some corporate social responsibility support to the Rotary Club of Sonde to help finish the infrastructure. Our biggest worry has been equipping this hospital, actually, because there's no need to have a beautiful building finished, and yet, you know, the mothers will still be on the floor, the babies will not have an opportunity to be supported in breathing as soon as they're born, and so on and so forth. So thank you so much for that heads up, and we will definitely.
Can you put together an itemized list with prices of the type of equipment you're looking for, how easily you can obtain the equipment, and what kind of money you're looking for?
Okay.
For a global grant, you got to have a minimum of $30,000 investment.
Yeah. Okay, thank you very much. Thank you very much. Our lead person on this, Dr. Linas, has already explored that, and I'll be able to share that, you know, by email. A lot of, you know, the breakdown and the costing. Thank you. Thank you so much.
Sounds good.
Okay. Thank you.
Thank you.
Thank you.
So
Thank you.
I want to take a moment to thank President Kate and the members of her club, the Sonde club, that were able to join us. Very inspirational. You guys are doing incredible work, and yeah, it's inspirational. Absolutely. There's no more words. And as John said, you know, I like to look at the silver lining in COVID, which is really hard to find sometimes. But, you know, Zoom has provided us the opportunity to meet people like you and your club members that we would have never been able to meet before. So let's find the silver lining. So thank you so much. And we look forward to hearing from you again. We appreciate that you're up in the middle of the night. You probably want to go to bed. You're more than welcome to stay. Our meeting's going to last a little bit longer, but you're more than welcome to stay if you'd like and see the rest of what our meeting is going to entail. I don't like to say, I'm trying to look at all of the comments here as well. We did have another component of our program this evening that had to be canceled last minute due to a medical situation, which, you know, silver lining, we got to spend more time with you. So, you know, things happen for a reason sometimes. So, but yeah, please stay on the call if you'd like. I do want to turn it over. We're going to skip over Happy Bucks for a moment. I think somebody, sorry, I'm trying to look at all the chats here, guys, but I'm not that technical. Y'all know that. So, but I do want to turn this over to Phil, who has asked for some time. And we're going to give it to you now.
Great, thank you. I just wanted to take a little bit of time to, number one, thank everybody who volunteered at RibFest this weekend. Things, although the numbers may not have been incredibly high, I think it was a great event. We certainly did have a great number of people come through. And, you know, it was a good event, I think, for us from a fellowship perspective to get back in touch with some people we haven't seen in quite some time. for me, in particular, to just meet people who I have not met before, other than in this one dimension that I'm staring at right now. So thank you to everybody. I wanted to give a special shout out to Chris Zelasco on this. He really put forth a gigantic effort on this with everything going on in the back. So congrats, Chris. You did a fantastic job on it. So I don't have any formal numbers to report at this point, and I'm sure that I'll leave that to Gord to pull the numbers together and Chris to present at some point. But again, a big thank you for everybody for coming out. It was a really good event. Secondly, you'll all see in your email, hopefully, that we have a golf tournament coming up that we're looking for some support from pretty much everybody on. All the details are contained within, but it's happening on Thursday, September the 16th at Newcastle Golf and Country Club. We'll be having a dinner afterwards, or late lunch afterwards, I guess I could say. And this is to support the Bowmanville Hospital Foundation as well as Rotary Club of Bowmanville. Foursomes are available for the fabulously low price of $800. And there'll be a plethora of prizes and all sorts of things at the golf tournament. So one of the more important things on that email is that there's a sponsorship list included. I've previously sent this out to select people who have been contacting people in the past, but I wanted to open it up to everybody to have a look at, to see if you have any contacts in there that you can possibly reach out to start grabbing some sponsors for this event. In the email, you'll find that there's a sponsorship package with links that Ellie had put together. Thank you, Ellie. She worked really hard on the sponsorship package as well as the golfer sign-up package. So you just click on those links. It'll take you off to a website to sign up your foursome or to become a sponsor. And if you know anybody who you want us to get in touch with, just reach out to Ellie, Steve Coder, and we'll handle it from there. But any help will be appreciated. We really want to fill those numbers out to help the club out. Okay, and that's really all I have to say. I'll turn it back to you, Amy.
All right, thank you very much. And for those of us who don't golf, I'm going to be there. I'll volunteer. Tell me what to do and I'll do it, but don't expect me to hit a club or a ball.
I've got you on my list, Amy.
It wouldn't happen. So
and just one slight clarification. There will be a light lunch and then a barbecue, steak and chicken dinner afterwards. So we've got both. Excellent.
Peter, did I see your hand up? No? No, okay. I wasn't sure. I also wanted to remind everybody, when we had the district conference, we were given, oh, hold on, somebody else is coming in. We were doing a beach cleanup, which of course the weather has been craptastic this summer. So we have now, yeah, that's a word. So we are now rescheduling that for this Saturday. So Saturday at 9:30 at the West Beach in Bowmanville. We're going to be meeting. We're hoping to have, an hour to clean up the beach. Everybody's welcome to come. There'll be gloves, there'll be bags. Depending on how many of us there are, we may have to separate into groups just so that we're abiding by all of the COVID rules. Although I did tell, I think I told Steve Kay, I said, there's a funeral director there. So we'll just pretend it's a funeral and then we're all good. So that's going to be Saturday at 9:30. Anybody who can join us. If there are students that are coming, please, Leanne, I don't know if your son's, oh no, he's away, right? And you're away. Yeah, but any students that do come, bring your sheets. They'll be signed off for hours. So we have a couple minutes. Do we have any happy bucks? Yeah, Leanna?
Oh, I just wanted to have a happy buck for the experience of meeting everyone and just having a Rotary fellowship feeling over the weekend with the Rib Fest, regardless of how it went monetarily or anything. It was really wonderful to meet you all. And Kate, thank you so much. Your speech was very humbling. The presentation was wonderful. Thanks for staying up late and sharing with us. So I have happy bucks for those two things.
You're good. Yeah, it was a great weekend, even though those of us who worked on Sunday. Chris, have you dried out yet?
Yeah,
Right?
I did.
Wet.
Man, we got wet on Sunday.
It must have been after I left. I left just in time, I guess.
You did, Joe. You and I had the heat, and then Chris and I had the rain. Chris
I'm
and
sorry. Well, you're the president, so you got to put up with that. Just to let people know, next week next Tuesday is Kirk Kemp from Goma Orchards talking about their operation there, in particular, paying particular attention to the great job they've done with sustainability. And we have managed, if anybody can spare any time on the first day of school, we actually have booked the Kathy Abraham, who is the trustee for our area, for the public board. And we have Jeannie, and I forget what her last name is, superintendent of the Catholic board. So as you're getting ready for school, you might want to fire your questions off to them, everything you wanted to know about back to school in the fourth wave of COVID.
I see you, Pauline.
Are you ready for me?
Yep.
Well, it's really happy back again. And I just want to say, Kate, thank you so much for talking to us this evening. And it was lovely to hear about Uganda again. And I say again because, you know, for many years, I think there was 8 years we supported a project in Uganda, and it was in Jinja. Is that far from you?
Jinja is actually in the same direction as our club. So it's about 30, 40 minutes from where we are. Thank you.
Well, we had a young lady who lived here, and when she was very young, like in her early 20s, she went to Uganda on a mission project and was so taken with what was happening there that she spent the next 8 years of her life building up what was called the Jinja Connection. And it was helping children, getting children off the street, rehabbing them, and education, and finding homes for them. And it was a delight to support that and see the good work that was going on there.
Wow.
So I would like to see something else in Uganda.
Thank you. Thank you. And warm welcome to all of you again, anytime. Thank you. Yeah.
So before we finish up this evening, I again want to thank all of you who have been joining us this evening. It's just so incredible, the things that we're able to do. So I actually have the quote of the week this evening, because I'm not sure who was supposed to, but here I am. So my quote is from Khalil Gibran, which kind of mirrors with Wayne. I was afraid, Wayne, when you started at the beginning, you were going to take my quote, but it's close. So what I have is, you give but little when you give of your possessions. It is when you give of yourself that you truly give. And all of us as Rotarians, I think, can appreciate that we do give, and it comes from the heart. So again, thank you all for joining us this evening. I look forward to hopefully seeing you again, Kate. And I look forward to hearing from everybody. And we will see everybody. Our next meeting is Tuesday, so only a couple of days. So we'll see everybody Tuesday morning, and enjoy your weekend.
Thank you.
See you Saturday.
Thank you.
Hey, congratulations on your great work.
Thank you. Thank you very much. Thank you. Thank you, everyone. Thank you.
Thank you so much.
Thank you. Thank you. Thank you.
Travel safely.
And Kate, going by your daughter's picture, she's beautiful.
Oh, thank you so much. Thank you. Barbara is still online. Is she hooked out? I can see David. Yeah. David, is Barbara still online?
No, I think she left.
Oh, yeah, she left. Yeah. Thank you so much. Thank you. I hope they can visit the club soon. Thank you. Thank you.
That would be
Kate,
lovely.
Kate,
Yes.
now you can go and get some sleep.
Yeah, thank you so much. Thank
Sleep
you,
well.
John. Thank you.
Sleep
Looking
well.
forward to you visiting Uganda sometime in future when COVID is, in control. Thank you.
Absolutely. All righty.
Yes, welcome.
Good night,
Thank you.
everyone.
Thank you.
Bye-bye now.
Good night.
Good night.
Good night.